tricks to help you live a healthier and Hi everyone, welcome to Health, Fitness and Nutrition, the channel where we share tips and tricks to help you. Hello and welcome to Health, Fitness and Nutrition, the YouTube channel where we share tips and tricks to help you live a healthier and happier life. In today's video, we're going to talk about 8 foods you should never eat raw. You might be surprised by some of them, so make sure you watch till the end. Raw food diets are becoming more popular these days, as people believe that eating foods in their natural state can provide more nutrients and enzymes. However, not all foods are safe to eat raw, and some can even be dangerous or deadly. Here are 8 foods you should always cook before eating. 1. Potatoes. Potatoes are a staple food for many people, but eating them raw can cause bloating and digestive problems. That's because potatoes contain starches that are resistant to being digested and can only be broken down by cooking. Raw potatoes also contain a toxin called solanine, which can cause nausea, vomiting, and even death in high doses. Solanine is more concentrated in green or sprouted potatoes, so make sure you avoid those altogether. 2. Rhubarb leaves. Rhubarb leaves, while visually appealing with their large, vibrant content. Thank you for watching Health, Fitness and Nutrition, and we'll see you next time. Hello and welcome to Health, Fitness and Nutrition, the channel where we share tips and advice on how to live a healthy and happy life. In today's video, we are going to talk about a very important topic, colon cancer. Colon cancer is one of the most common types of cancer in the world, and it can affect anyone at any age. However, if detected early, colon cancer can be treated and cured. That's why it's crucial to know the signs and symptoms of this disease, and to get screened regularly. In this video, we will tell you the top 10 early warning signs of colon cancer that you should never ignore. Let's get started. 1. Change in bowel habits. One of the most common signs of colon cancer is a change in your normal bowel habits. This can include diarrhea, constipation, or alternating between both. It can also mean having stools that are narrower than usual, or feeling like you can't empty your bowel completely. If you notice any of these changes for more than a few days, you should see your doctor as soon as possible. 2. Blood in stool or rectal bleeding. Another sign of colon cancer is blood in your stool or rectal bleeding. This can be bright red, dark red, or black in color. Sometimes, the blood may not be visible to the naked eye, but it can be detected by a fecal occult blood test, FOBT. Blood in stool or rectal bleeding can also be caused by other conditions, such as hemorrhoids, ulcers, or inflammatory bowel disease, IBD. However, you should never assume that it's nothing serious and always consult your doctor. 3. Abdominal pain or cramps. Abdominal pain or cramps can be a sign of colon cancer, especially if they are persistent or severe. The pain can be caused by the tumor growing in the colon, or by blockage or perforation of the bowel. The pain can also radiate to the back or pelvis. Abdominal pain or cramps can also be due to other causes, such as gas, indigestion, or menstrual cramps. However, if the pain is unusual or lasts longer than usual, you should seek medical attention. 4. Unexplained weight loss. Unexplained weight loss is another sign of colon cancer that you should not ignore. This means losing weight without trying or without any changes in your diet or exercise routine. The weight loss can be caused by the cancer cells using up more energy than normal, or by the loss of appetite or nausea that often accompany colon cancer. Unexplained weight loss can also be a symptom of other diseases, such as diabetes, thyroid problems, or depression. However, if you lose more than 10 pounds without a clear reason, it's important to discuss it with your healthcare provider. 5. Fatigue and weakness. Colon cancer can cause fatigue and weakness due to the body's increased energy demands as it fights the disease. You may feel tired even after getting enough rest and sleep. Fatigue can also be a result of anemia, which is common in colon cancer due to blood loss from the digestive tract. If you experience persistent fatigue and weakness, it's important to get evaluated by a healthcare professional to determine the underlying cause. 6. Changes in appetite. Changes in appetite, such as a sudden loss of appetite or a significant decrease in food intake, can be a warning sign of colon cancer. Tumors in the colon can affect your digestive system, leading to a reduced desire for food. Additionally, some individuals may experience nausea, vomiting, or changes in taste preferences. If you notice a significant change in your appetite or eating habits that lasts for an extended period, it's advisable to seek medical advice. 7. Iron deficiency anemia. Colon cancer can cause chronic bleeding in the gastrointestinal tract, leading to iron deficiency anemia. This type of anemia occurs when your body doesn't have enough iron to produce sufficient red blood cells. Symptoms of iron deficiency anemia include fatigue, weakness, pale skin, shortness of breath, and dizziness. If you experience these symptoms, it's crucial to undergo further evaluation to determine the cause, including the possibility of colon cancer. 8. Persistent abdominal discomfort. Chronic abdominal discomfort, such as cramping, bloating, or gas, can be indicative of colon cancer. The tumor growth or obstruction in the colon can cause these symptoms to persist over time. It's important to note that occasional abdominal discomfort is common and may be caused by factors like diet or indigestion. However, if you have persistent or worsening abdominal discomfort, it's essential to consult a healthcare professional for a proper evaluation. 9. Changes in stool consistency. Pay attention to any changes in the consistency of your stools. If you notice that your stools have become consistently narrower or thinner than usual, pencil-thin stools, it could be a sign of colon cancer. The narrowing of the stool may be caused by a tumor partially blocking the colon, resulting in a change in the passage of stool. While changes in stool consistency can be caused by various factors, it's important to discuss them with your doctor, especially if they persist for an extended period. 10. Family history and personal risk factors. Having a family history of colon cancer or certain personal risk factors can increase your likelihood of developing the disease. If you have a close relative, parent, sibling, or child who has had colon